I mean, we say this here all the time, and every EMS person knows this, every ER knows the
Right.
ABCs. Follow the ABCs. Like if somebody's having an emergency, ABCs every day of the week. That's what they do.
Which is airway, breathing, circulation.
Right. And airway, and it's in that order.
Right.
Specifically, because if you don't have an airway, you're dead. Like
Right.
there's no, breathing is sort of the step beyond that. You need to have an airway to breathe. You know, so you need an airway first. You breathe through that airway. That's where we come into play. Is we establish airways that are properly working to allow you to breathe like you're supposed to breathe, which is mouth shut, nose open. That's how you're supposed to breathe. That's how any animal's sort of built to breathe. And then the circulation is sort of A, B, and then a pause, C. Circulation, which is heartbeat and the blood moving around.
Right.
That's in that order. But the challenge is well, unless like if you're eating something you're choking on it, then that's where it becomes crystal clear how important that breathing is. Like literally, your
Yes.
airway has been taken over with a piece of steak, and so you are, or whatever it is, and so you're struggling, and
Right.
you will die unless somebody does something, or you can do something to get it out of there. But I think for those that are sort of compromised, less intense than that, you're not dying, you're barely, you're just getting by, and then a lot of folks just sort of forget that that's a problem.
Mhm.
Yeah. Although I think when somebody has sleep apnea, it is like that choking on steak kind of a thing, and that's it's oftentimes every minute of every hour of the sleep that you're trying to get.
Yeah, I mean, the analogy you use where you're getting strangled in your sleep, but then, in this day and age, which you couldn't have done probably 20 or 30 years ago, is now you have a phone, and there are apps that record what you sound like.
Right.
Do it. Listen to yourself.
Sure.
Like, if that's not a motivator, if people hear what they sound like
Right.
at nighttime, it motivated me. It motivated me to do something about my son, and things like that, because you're like, holy crap, like this is bad.
Right.
And that can't be normal, and then, okay, I want to address this issue, and then if you said, and it's just not as in vogue or, I mean, this, for lack of a better term, it's not like a sexy medical condition, and I don't mean that in a good way, but in the way that like a cardiac surgery and like just kind of the somewhat obsession just to healthcare in general about some of these bigger disease things, and like, ER shows about the heart and getting in the chest and all these things like that, like, your nose and breathing through it is just not that, right? And so there's not, scripted Broadway shows about it and things like that, but like it's important, and it matters, and it's equally important, if not more important, than some of those other conditions that are out there. And so again, I always come back to being a public awareness kind of, like people need to be aware of what these things are and how important it is for their life.
Right. Yeah, and a lot of those, I guess a lot of those sort of, how do you say this, more typically acknowledged impactful issues like heart disease, strokes, diabetes, depression, dementia, all those things are can be a byproduct of improper breathing. So if you have
Right.
sleep apnea, everything I just named, you're at high risk for those things. So forget about it. I mean, we're kind of going a little bit more on the little bit more lighthearted part, which is the snoring part. But then there's the real part of the fact that if you're snoring every night, so if basically, bottom line, if somebody's snoring on a consistent basis, their likelihood, they're absolutely at risk for sleep apnea. It depends. They may not have it. It's certainly possible you don't. It's certainly possible you do. If you snore and you have sleep apnea of significance and it's not getting treated properly, then your risks of heart attacks, strokes,
Right.
depression, dementia, you bang down that list of all the things you don't want to have happen to you as time goes on, and those are right there on the list.
Yeah.
And then the challenge for us sometimes is we identify and fix the breathing issue, and if somebody has sleep apnea, that's part of that. So we get them breathing properly, therefore get them sleeping properly. That's all good. And then all of a sudden you've just sort of diffused the time bomb that was about to go off on them, and we'll keep following our patients as long as we need to follow them. But it's the heart attack or the stroke or the diagnosis of diabetes that doesn't happen what's the reward for that? Like, how do you know what you've prevented that way?
Right.
But the way we know is studies. Every single study looking at this has been conclusive that this is what happens: is you start this issue. If you want to sort of have somebody, if you want to give somebody a poor and sad life, give them a breathing issue, give them sleep apnea, and then see what evolves.
They're saying it's just because sleep apnea doesn't end up on a death certificate that people don't have quite the same knowledge, or it's not talked about in that sense, but it's the cardiac event, it's the heart attack, it's things like that for a person that had sleep apnea. And there's an analogy I like to use a lot, and I use it in patient room all the time, especially when we get like nose is working, and let's say they had nasal congestion, and then they have sleep apnea, but they're feeling better, and they don't want to treat the underlying sleep apnea. Mm-hmm. And so the conversation might be like, hey, I'm doing you a disservice if I don't treat this other issue too. And so what I always tell patients is, okay, you have undiagnosed sleep apnea, you're walking around, you're holding a grenade, the pin's pulled, you just don't know if you're ever going to drop it, but you could, and it's going to go off. You get diagnosed, pin goes back in, you're still holding it. We get it treated, grenade goes back on your belt, right? So I mean, it's just kind of like leveling you up and trying to give people a perspective of like, okay, well, what's my urgency here, and like, okay, you have grandkids, or maybe you have a kid and you're there and you want to be around for that person. So if you have a 5 times higher risk of having a stroke, wouldn't you rather like take that off the table?
Sure.